reflex. When kick a person with a hammer, it causes the lightning quick knee-jerk reflex occur within the spinal cord. The kick simply indicates that section of spinal cord and nerve extending from it are working properly. How it works: tendons below our kneecap connect the quadricep muscle on the top of our teeth. The hammer's cap on the tendon slightly stretch the muscle. Sensory nerves in the muscle are stimulated by stretching and send an impulse to the spinal cord. Motor nerve in the spinal cord then conduct the impulse right back to the quadricep, triggering a muscle contraction that makes us kick. Pupillary reflex. Physiology behind a normal pupillary constriction is a balance between the sympathetic and parasympathetic nervous system. Parasympathetic innervation leads the pupillary constriction. A circular muscle called the sphincter pupillae accomplishes this. The fiber of the sphincter pupillae encompass the pupil. The pathway of pupillary constriction begins at the nucleus near the oculomotor nerve nucleus. The fibers enter the orbit with CN3 nerve fiber and ultimately synapse at the ciliary ganglion.
Color blindness test. Color-blind individual should see the yellow square. For color normal individual should see the yellow square and a faint brown circle. Color blindness is the inability to perceive difference between some of the color that others can distinguish. This is mainly due to genetic factor. However, damage of brain, nerve, or eyes, or exposure to certain chemical can also contribute to this deficiency. This type of blindness is happening due to absence of red or green cone in the retina. However, color blindness may not interrupt other eye ability. The subject is not color blind, as all the features in the manual can be determined by the subject correctly. Visual acuity test. The visual acuity test is used to determine the smallest letter you can read on the standardized chart or a card held 20 feet away. Special charts are used when testing at distance shorter than 20 feet. You will be asked to remove your glass or contact lens and stand or sit 20 feet from the eye chart. You will keep both eyes open. You will be asked to cover one eye with the palm of your hand, a piece of paper or a small paddle where you read out loud the smallest line of the letter you can see on the chart. Number of pictures are used for people who cannot read, especially children. If you are not sure of the letter, you may guess. This test is done on each eye, one at a time. If needed, it is repeated while you wear your glasses or contact. You may also be asked to read letter or number from a chart held 14 inches from your face. This will test your near vision. Visual acuity test is expressed as a fraction. The top number refers to the distance you stand from the chart. This is usually 20 feet. The bottom number indicates the distance at which a person with normal eyesight could read the same line you correctly read. For example, 20/20 is considered normal. 20/40 indicate that the line you correctly read at 20 feet away can be read by a person with normal vision from 40 feet away. Even if you miss one or two letters on the smallest line you can read, you are still considered to have vision equal to that line.
Visual sensation up. If we place the candlelight about 6 inches from someone's eye in order that we can see the flame on the cornea, when we are sitting to the side of the visual axis of the eye, within a circle of pupil near the periphery, we will see in the back of the pupil a blinking flame. still smaller in its diameter but reverse and of feeble illumination, which we can easily judge by comparing it with the one on the artificial lens that it reflects from the posterior walls of lens. The front surface of the lens and partly its inner matter under condition of full transparency we can make accessible for observation if, by looking into the pupil from the side and by placing the light on the opposite side of the eye, the straight line of the eye to the observer, and from the light of the candle shining into pupil from an obtuse angle. Here one will see an elongate image of the flame, which, because it is straight, show that it is reflected from the convex surface of the lens. Both of these methods for the observation of the surface of the lens will not be without use, I think, in therapeutic investigation, especially where one to differentiate precisely whether only the capsule of the lens is involved, the lens itself, its posterior surface, or the vitreous humor. From the exact measurement of the flame reflection on the lens of the living human subject, one can determine with considerable level its shape and its relation to the acuity of vision. Accommodation, of course, is linked to the difficulty that some individuals have in focusing on near and far objects, that is, the errors of refraction that widespread in the population. Telescope and microscope use the basic principles round lens to explore the upper and lower limits of nature inaccessible to the naked eye. Yet, there was a long period before the connection between eyeglasses and other optical instruments was made. Ophthalmoscopy examination. Ophthalmoscopy or fundoscopy is a test that allows a health professional to see inside the fundus of the eye and other structures using an ophthalmoscope or fundoscope. It is done as part of an eye examination and may be done as a part of routine physical examination. It is crucial in determining the health of the retina and the vitreous humor. An alternative or complement to ophthalmoscopy is to perform fundus photography, where the image can be analyzed later by a professional. Ophthalmoscopy is used to screen for eye disease and conditions affect the blood vessel. These include diabetes, glaucoma, hypertension, macular degeneration, and melanoma. The only risk of ophthalmoscopy is that of having a reaction to the eye drops. Such reactions are rare. However, they may cause dry mouth, flushing, narrow angle glaucoma, dizziness, nausea and vomiting.
In audiometric examination, the subject needs to put on the headphone which is connected to the audiometer. The subject is tested to hear the sound that the audiometer making at certain level of frequency and decibel using left and right ear separately. Then the result is recorded in the audiogram. Based on the result on the audiogram, the subject starts to hear the sound at 500 Hz and hearing level is at 25 decibel for both ears. Then the result show that the hearing level increase when the frequency increase. This show that the subject is normal, since theoretically the normal range of human hearing is about 20 Hz to 20,000 Hz. In otoscopic examination, the subject ear is pulled slightly to the front and above in order to straighten the ear. Next, the otoscope is entered to the ear canal properly. Then, the observation through the speculum into the ear is recorded. Otoscopic examination can be carried out in order to examine the auditory canal and certain part of the ear for infection or blockage. From the experiment, the subject is normal.